Hello, everybody. I hope you're doing very well, enjoying your evening or your day. I'm nutritional scientist Liam McCauley, back here again for another video. And in this video, I want to cover three essential nutrients that are very effective at treating viral infections. Now, the first nutrient I want to cover is a vitamin, and it is vitamin C. And to analyze vitamin C's effectiveness at treating viral infections, I want to analyze this article here. Again, this article is possible application of high dose vitamin C in the prevention and therapy of coronavirus infection. You should be familiar with this virus by now. This is the COVID-19 virus, but vitamin C can be quite effective for all types of viruses, including influenza, more commonly known as flu. Okay, so coronaviruses such as severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, COVID-19, and influenza, the flu viruses, increase oxidative stress in the body. Now, oxidative stress, we hear this term all the time. That's basically the stress that is put upon our body caused by oxygen. Oxygen is, yes, essential for life, but sometimes it misbehaves. It likes to steal electrons and cause a lot of damage. And so we need to counteract this oxidative stress, okay? This leads to cellular and tissue damage, so damage to the cells and tissue, which is made up of usually multiple different types of cells, okay? To combat this, administration of high dose vitamin C, typically over about 1,000 milligrams, which is a very high dose, is well above the RDI, but that's usually what's necessary. 1,000, 2,000 milligrams is what I typically recommend. Okay, in addition to standard conventional supportive treatments, has been shown to be a safe, okay, that's the most important thing, very safe and effective, that's very important as well, therapy for severe cases of respiratory viral infection. Okay, so viral infection of a virus in the respiratory system, so in your trachea, your bronchi, your bronchiole, your lungs, any sort of viral infection in that respiratory system, vitamin C is effective and safe at treating these conditions. Okay, morbidity, okay, that just simply means disease or disease state. Mortality, which is death. Uh, Infectiveness, okay, how well the virus is able to infect you, okay, and spread of infectious diseases are dependent on the host pathogen relationship. Okay, the host is simply the person or the animal or whatever living being, it can be a microorganism as well, that has been infected with the virus. Okay, so if I had COVID-19, then I would be the host. Pathogen is just something that causes disease. Okay, in this case, we're talking about a virus, but path simply means disease. So if you hear about the pathologist, that path prefix there means disease. And this suffix here, gen, just means to create. So something that creates disease. Okay, given the lack of effective and safe antiviral drugs, so drugs that treat viruses, for coronaviruses, there should be more attention in supporting host immune defense. Cytoprotection, okay, cyto is a prefix that means cell, so this is protection of the cell, and immunoregulation, so basically regulation of our immune system. Okay, implementation of high dose vitamin C, typically above about 1,000 milligrams, could dramatically reduce the need for high doses of corticosteroids. Okay, corticosteroids are used to treat inflammation and help with immune responses. Okay, they're produced in the cortex of our adrenal glands. Okay, so we don't need these as much. Obviously, you take synthetic forms for medication. Antibacterials, okay, that they're typically not useful for viral infections as they treat bacteria, which is not a virus. Okay, and antiviral drugs that may be immunosuppressive. Okay, they reduce your immune system. Okay, well, your immune response. Okay, adrenal depressive and toxic. Okay, so a lot of these drugs can decrease the adrenal glands' ability to function. Okay, and they can become quite toxic, which will, have the same sort of conclusion. Okay, complicating the disease course. Okay, it makes things much more difficult. In order to effectively fight the novel SARS-CoV-2 virus, medical professionals should explore readily available pharmaceutical and nutritional therapeutic agents with proven antioxidant, anti-inflammatory, and immunosupportive properties. That's vitamin C. Vitamin C is a powerful antioxidant. It is powerful in its anti-inflammatory ability, and it is very supportive of our immune system. Okay, supplemental vitamin C may also provide additional benefits for the prevention of viral infections. Okay, shorten the disease course, so shorten the length that you have the viral infection, and lessen complications of the disease. So comorbidities, these diseases that come from the disease. Basically, I can't encourage vitamin C usage enough when it comes to treating viral infections. I strongly encourage, if you are ever sick with what you believe to be a viral infection, 1,000 to 2,000 milligrams of vitamin C. Yes, it has some side effects. It can cause diarrhea, but it's generally considered safe because of vitamin C being water soluble, which means it doesn't really store in the body. It will be excreted in the urine. I can't encourage it enough. Please, if you are feeling sick, if you're watching this video right now and you are feeling sick with what you believe to be a viral infection, please take some vitamin C. Thank you. So the next nutrient I want to take a look at in regards to its ability to treat viral infections is the powerful and amazing vitamin D. And what an amazing nutrient this is. Has many roles in our body, and just one of them is to help our immune system. Okay, to analyze vitamin D, I just want to look at this article here, posted in 2011. So vitamin D and the antiviral state. Okay, so vitamin D has long been recognized as essential to the skeletal system. Very important that helps with calcium absorption, bone deposit, very essential. Okay, but it has many other supportive roles in the body. Okay, newer evidence suggests that it also plays a major role regulating the immune system. So this is massive for viral infections. Okay, because viral infections put our immune system under a lot of stress. Okay, that's probably an understatement. Perhaps including immune responses to viral infection. Okay, that's encouraging. Interventional and observational epidemiological studies. Epidemiological just means epi means upon, demi means the people or the demographic. Okay, so it means doing studies upon the people. Okay, provide evidence that vitamin D deficiency may confer increased risk of influenza and respiratory tract infection. Okay, vitamin D, so important. Okay, vitamin D deficiency is also prevalent among patients with HIV infection. Okay. Cell culture experiments support the thesis that vitamin D has direct antiviral effects. Okay, so it is able to help eliminate viral infections. Okay, particularly against enveloped viruses. Though vitamin D's antiviral mechanism has not been fully established, so we're not quite sure of how it's able to do this. We're just aware that it is able to do it. Okay. It may be linked to vitamin D's ability to upregulate the antimicrobial peptides LL37 and human beta defensin 2. Okay, so antimicrobial, okay, that just basically means against microorganisms, which viral agents such as COVID-19 and influenza are microbes. Okay, and peptides just basically means protein. Okay, additional studies are necessary to fully elucidate the efficacy, and mechanism of vitamin D as an antiviral agent. So, like I say, once again, not too sure about how it's able to do this, but because of vitamin D's, it's quite rare for toxicity, even considering it's a fat-soluble vitamin, so it can be deposited in that adipose, that fat tissue. I can't encourage it enough. If you're having an infection, I think up to 10,000 international units. Generally, that is considered very safe. To even take for quite extended periods. There's actually quite a lot of research saying that you can take that for many years. So up to 10,000 international units. You can have as low as 2,000. It's up to you. It's much big dose, much higher than the RDI. If you're having any viral infection, strongly encourage you supplement some vitamin D. You'll feel a lot better. The last but not least essential nutrient I want to discuss is the powerful mineral zinc. Very powerful. Okay, I can't encourage its use enough to treat many diseases and many pathological states, especially those with a zinc deficiency, which I myself have always struggled with zinc. I've had zinc deficiencies many times in my life. Okay, but let's talk about zinc and its powerful ability to treat viral infections. Okay, so if we read this article here, nonetheless, zinc treatment applied at a therapeutic dose, okay, I'll typically say somewhere above or around 25 milligrams, okay? And in the right form, I typically recommend the highly bioavailable, so it's highly absorbed, zinc picolinate, okay? Around 25 milligrams or more. Keep in mind the RDI is about 14, depending on what country you're in, okay? Has the potential to drastically, okay, not just improve, drastically improve the clearance of both chronic and acute viral infections, okay? Chronic means long-term, so long-term viral infections, and acute viral infections, okay? So acute viral infections would be things like COVID, the flu, okay? And chronic could be things like herpes virus, okay? As well as their accompanying pathologies and symptoms, okay? So it can help with that symptom control, okay? Consequently, the role of zinc as an antiviral can be separated into two categories. Zinc supplementation implemented to improve the antiviral response and systemic immunity in patients with zinc deficiency. So it's obviously, it goes without saying, it's incredibly powerful for those who already have a zinc deficiency. You definitely need to be supplementing with zinc if you have a viral infection. But what's even more impressive is zinc can be used even regardless of having a zinc deficiency, is very effective for treating viral infections. Okay, so zinc treatment performed to specifically inhibit viral replication or infection-related symptoms. Okay, so it can be used to treat those symptoms and reduce the ability of the viral infection to replicate, to increase its numbers. So essentially by doing that, you are decreasing the ability of the virus take over and consume your body. Okay, zinc, can't recommend it enough. Like I say, around 25 milligrams and up. I would never go over 100 milligrams. I mean, even getting close to 100 milligrams is a massive dose. And another thing to be careful of is it affects your copper absorption. So you might want to take a copper supplement as well to go with that, maybe 2 milligrams. But zinc, I can't encourage it enough. Please take your zinc when you're feeling sick. Very important. Thank you everyone for watching. I hope you've learned a thing or two, and I really appreciate all the support you guys have been giving me recently. Any of you who are watching right now and you're feeling sick, I hope you feel better soon. I really do. And I hope the information I provided can be of some assistance. The last thing I just want to remind you is for D3 supplementation when supplementing with vitamin D. D2 is not that bioavailable or effective. So make sure you supplement with vitamin D3. That's all, guys. Get better soon, and I'll see you soon. Take care.